At this part, we are going to talk about periodic patterns. But before we introduce the periodic patterns, there are some old terms that are taken place by new terms we have to know. For example, triphasic waves are taking place by continuous 2 per second generalized periodic discharges with triphasic morphology. And the old terms like plates, biplates, G-plates are taken place by LPDS, BIPDS, and GPDS. The word E-epileptiform is taken down due to a reason that not all periodic discharges are epilepton discharges. First, we talk about lateralized periodic discharges, also known as periodic lateralized epilepton discharge, its old name. It's lateralized to one hemisphere. It has a consistent morphology that recurs at periodic intervals, most frequently between 0.5 and 3 Hz. It's commonly associated with an acute structural lesion involving the cortex. The most common etiology is ischemic stroke, especially cortical stroke, which accounts for nearly 50% lateralized periodic discharges. But it may also be seen without any obvious structural lesion. It's usually simply a sign of dysfunction and do not represent seizures. That's also the reason why we take down the word epileptiform. But if the frequency is more than 3 Hz, or if there is electrographic evolution, it should be considered ictal on electrographic criteria alone. In this EEG is double banana montage. We can see there are periodic discharges over right hemisphere, with duration around 2 seconds. It's a patient of hypasic encephalopathy. And bilateral independent lateralized periodic discharges has the clinical significance as same as plates, but they are skewed toward the more multifocal or diffuse etiologies. The most common etiologies are cerebral infections and anosmia. Biplates have mortality rates of about 60%, which is twice the overall rate for plates. Then we talk about generalized periodic discharges, also known as generalized periodic epilepton discharge. In contrast to biplates, GPDS has synchronized high voltage spikes or sharp waves. It usually represents acute and subacute diffuse cerebral dysfunction. They can be divided into short interval and a long interval, which is more than 4 seconds. The most famous example of long interval generalized periodic discharge is subacute sclerosing panencephalitis. And this is an example of short interval GPDS. We can see synchronized high voltage spikes. And this patient suffers from CPCR, has diffuse hypasic encephalopathy. This is another patient's EEG. It's another example of short interval GPDS. This patient has CJD. And the GPDS with triphasic morphology. Triphasic wave consisted of 2 or 3 phases, with each phase longer than the previous, and a positive phase of highest amplitude. If it consisted of 3 phases, it should be negative, positive, and negative. If there are 2 phases, it should be positive and negative, with positive phase of highest amplitude. And there are usually anterior-posterior delay, which means delay of more than 100 milliseconds from the most anterior to the most posterior derivation. They are classically seen in hepatic encephalopathy, but they can be seen with uremia, sepsis, and electrolyte disturbance too. In this EEG is double banana montage. We can see there are synchronized periodic discharges with triphasic morphology. Negative, positive, and negative phase, with positive phase of highest amplitude. This is a patient with CKD who received cefepime. And the last one we talk about burst suppression. It is characterized by a cycling of marked depression of cerebral activity and a burst of cerebral activity of variable amplitude, duration, and waveform. The burst can consist of multiphasic delta components and mixtures of various frequencies or epileptic activity such as spikes or sharp waves, often with admixed slow components. They are usually medically induced, for example in patients receiving general anesthesia. Or they can be seen in patients with CPCR who suffer from cerebral anosmia. This is an example of burst suppression. We can see period of suppression followed by period of burst. And the burst can consist of variable amplitude and variable frequency waves. In this case, it consisted of many spikes. And this is a case of hypoxic encephalopathy. And this is today's talk. Thank you for your listening.